It is estimated that over 1 billion young adults are at risk of getting permanent yet avoidable hearing loss. Recent data shows that in the last 2 decades, the number of hearing impairment cases in the country has risen. This week on Health Watch, we take a look at how the use of technology can help improve this status. My name is Sada Hassan. Body organs are critical, essential parts of every human, and they are important in an equal manner as they play key functional roles. The ears, small parts of our bodies that without them we will not be able to hear and differentiate sounds within our surroundings. Some people suffer from hearing impairment, and it can be caused by several factors from congenital to human-induced hearing loss. Sydney Chahonyo, a father of 4, is one man who has seen a fair share of partial hearing loss, but that has not stopped him from going about his life.
At about the age of 7, we had gone to Mombasa on a family trip, and I got a very bad case of mumps. And I was taken to the hospital, and I was treated for malaria. And my body reacted to the treatment and the sickness and the medications they were giving me, and I lost hearing on my left side.
Fast forward a few years later, and things got worse.
At the age of 19, I was diagnosed with cancer of the postnasal space. And at this point already, I had one-sided hearing. And one of the things that they told me before my treatment was that there was a chance that I could lose my hearing, especially because of, number one, the radiotherapy and the proximity to where the cancer was, and secondly, my chemotherapy drug, carboplatin.
In 2004, he finished his treatment. He was optimistic that life would change, but things were to get far much worse.
And it wasn't until 2017 that I got a significant amount of hearing loss, whereby at some point, I think I was at home, and I just started feeling like just a strange noise in my ear, like, you know, the way you crumple a paper. I just started hearing that noise. And after a while, it just felt blocked. So at that point, I went to seek help. I went to see my ear, nose, and throat specialist. And he reminded me that it is probably a long-term effect of the radiotherapy that I got during my cancer treatment.
According to literature, the hearing of a human being starts from the outer ear. At the trigger of a sound outside the outer ear, the sound vibrations move down the external auditory canal and strike the eardrum. It then vibrates, and the vibrations are sent to 3 tiny bones in the middle ear called ossicles, which then amplify sound. Sound waves are then sent to the inner ear into the fluid-filled hearing organ, the cochlea. Once the sound waves reach the inner ear, they are converted into electrical impulses, and the auditory nerve sends these impulses to the brain, which translates them as sound. We head to the Doctors of Hearing Clinic to understand more about ear health. We meet Richard Mwangi, who has specialized in hearing health for over 17 years.
When you talk of the hearing healthcare in specific, is that we try to diagnose the levels of the hearing impairment. First of all, we want to see whether somebody's hearing is normal or it's not normal. Now, if it's not normal, we diagnose whether it's mild, moderate, moderately severe, severe, or profound. Profound is the worst case scenario. You'll find that somebody is deaf. But when you talk of mild to about severe, those cases can be handled either by use of the hearing aids or the cochlear implants.
The World Health Organization estimates that about 430 million people across the globe require rehabilitation to address their hearing impairment. This translates to at least 432 million adults and 34 million children.
See, hearing loss can occur. It's not a specific group or it's not a specific region. It can occur to anyone. It doesn't discriminate. So when you say of hearing impairment as a result of, say, congenital hearing impairment, is that you may find that during the baby formation, you know, some organ, let's say now where we come into, is the cochlea. The cochlea is inner part of the ear. didn't develop properly, or it developed and then you find that there's something called outer hair cells function or inner hair cells function. Those hair cells were not formed properly. Another thing that causes is that you may find that maybe the mother had some diseases, or maybe the mother had what we call high blood pressure, or had diabetes during pregnancy. Some diseases that a mother can contract during pregnancy can be of a major reason why the child is born with a hearing impairment.
When hearing loss is not addressed, it has a life-changing impact on an individual, which Sydney can attest to.
From the time I now got that significant amount of hearing loss, it's very strange because I had just started a new job, and I was doing my induction. And because of that issue, now I had to leave that job. And I then walked into an office where I was fitted for a hearing aid. And the hearing aid that came it didn't work as well as it should have. And that is when I looked for a second opinion.
He then did another audiology exam at a different clinic where he found a specialist that diagnosed his problem.
He did another audiology exam, and he took me through the different, he explained to me, number one, what was wrong with my ear, why it was not working. And he actually gave me a lot more comfort because he was more empathetic. He asked me what my issues were and what my fears were, and I answered his questions, and it just made me feel very comfortable. So from that point, I just decided to go with him, and he fitted me, and he fitted me for the hearing aid. He took an impression of my ear, and then the hearing aid took about, I would say, a month or 2 months to be manufactured and brought to Kenya. And then I came in for another appointment where he put in the hearing aid, and he configured it to my standards.
In an ideal setting at birth, every child should be checked for any signs of abnormalities like congenital cataracts, as well as their hearing and vision. This should be done several times during their early development so that if found, they can be corrected as early as possible. At times, this fails to happen at our Kenyan hospitals. To improve the hearing capacity of people affected, most depend on hearing aids, and in extreme cases, cochlear implants are used. Sydney explains that without the hearing aid, he cannot hear much.
Home with my family, it was a bit hard, especially in that waiting period between the time I was fitted and the hearing aid came, because you kind of start getting kind of depressed because you can't hear what's going on, you can't, you're almost isolated. So I think there was a point I was maybe on borderline depression. But once the hearing aid came, it changed my life completely. Right now, I cannot communicate without it. This is the part that goes into the ear, and this sits behind the ear. It houses the computer and the batteries. And I remember even when I was younger and I lost my hearing at 7, I was given a hearing aid for this ear, but it didn't really work because there was a lot more damage. But the hearing aid was almost like, it was so much bigger. It was very visible. Right now, even people look at me and they don't know I'm wearing a hearing aid.
Picture how the public address system works. So amplify the sound, is it? So the hearing aids, what it does, it is more a prescription device, but with keeping back in mind the knowledge of how the public address works. So it has got an amplifier, it goes a microphone, it goes in a receiver, it is powered by a battery. But on top of that all, it has a programming chip. The programming chip helps in determining how much power you give a patient, how much amplification you give the patient, because as per the test, you should give it. See, when you are going to get glasses, we have to be, tested which is our power. So the hearing aids also, when you're doing the programming, when you're doing the amplification, is that you have to give the power as per the hearing impairment so that you don't overdo it and you don't underdo it. And then the cochlear implant is an implant. It's implanted device, okay? So this one, it is used when the hearing aids has failed. There's so many candidacy questions that has to be asked when you're considering the cochlear implant, because it is surgically implanted device. So what happens that you have to try the hearing aids first for about 3 months, see whether it works for this.
According to Sydney, most people assume that because he has a hearing aid, then he is okay, but at times that is not the case, since his left ear does not function well and he has to turn to his right often to listen to what the other person is saying.
Sometimes, once people think you have a hearing aid, once they know you have a hearing aid, they think that everything is now perfect, like you can hear like a normal person, which is not necessarily true, because the sounds are kind of different. And also, with my one-sided hearing, I have those issues of if you're on one side, I won't hear you properly. So in the family setting, they pretty much understand it. But once I get into a more crowded area or a more a noisy place, like if I'm walking downtown in Nairobi, it becomes a bit overwhelming sometimes, where I have to reduce the volume because there's a lot of distracting noises that are out there that are amplified just as much as the sounds of people talking.
Mwangi explains that the advantages of hearing aids are far too many as they change the lives of those who had hearing problems. Despite them being important, hearing aids and implants are costly.
Some international insurance cover for it. NHF is covering for the comprehensive covers. We also have National Council of Persons with Disability for the people who have been registered in such kind of a disability, covering for the hearing aids. Now, the cost varies. As I mentioned, it's a prescription device, so it varies between how much amplification you have, what specification are you looking for. Because what you find with the hearing aids is that some of them, they are compatible with Bluetooth. Some of them have got technology that helps the child develop speech faster, because you see, if a child is wearing the hearing aid, I'm talking using some compatible device through the ears, it becomes more clear for the child to understand. So it varies, the prices varies. But the basic hearing aids will range from about 40,000 a piece. Okay, they can go up to about the price of about 100 to 120. Yeah, the cochlear implant in this country, I think, is about 2.65 to about 3 million Kenya shillings for the cochlear implant.
Hearing problems are gradual, and Sydney has learned to adjust his life to fit his needs.
This particular hearing aid is Bluetooth enabled. So, for example, if somebody calls me, it streams directly to my hearing aid. So I don't have to put the phone on my ear. Like there are situations where sometimes in the office phone rings and I put it on my ear and I can't hear properly because the hearing aid is different to your ear. But now with the Bluetooth capabilities, someone calls me, I hear it straight in my ear. Sometimes I can even get a message tone in my ear. Like I can configure the phone to say, okay, you have a message, send it straight to my ear. I have a smartwatch which acts as my alarm. For example, I have to wake up at 6 in the morning, I set my alarm. I won't be able to hear the alarm because, I have hearing issues. But my smartwatch, I'll sleep with it and it actually vibrates to alert me that it's time to wake up.
He desires to see a change in our society, starting from the curriculum, where the government should integrate sign language as part of daily subjects and have people integrated into the learning community. Different job groups have different risks that can result in a noise-induced hearing loss, but still human beings in their natural setting can cause harm to themselves.
Lately, you've seen people using the stereo earbuds, these ones that comes with the phone, okay? And it's the young adults, the youth, and of course even some adults are using them. Now, when they're using them, it's risky for their hearing, okay? How risky is that? You see, the matters also we talked about noise-induced hearing impairment, they also exposing them to noise. Because look at it this way, this person is using the headphones, the small ones, okay? And if you just hoot behind them, they cannot hear. So how loud is that sound they're listening to? Another thing is that those small ones, there's nowhere the sound pressure is escaping, okay? Comparing to the big one. You see the traditional one, the old school ones, those ones, they're good. Because somebody may ask, now that you're going to virtual meetings and everything and working virtually, How do I listen to privately to my conversation? They can use the big ones, because the big ones just covers up to that point. So there's a bit of sound pressure escaping from there, in between the skin.
Some newer technologies have been manufactured to help people with hearing difficulties. But with human-induced problems, prevention is better than cure. Sada Hassan, KTN News in Nairobi.